ఆన్లైన్ మీరు డౌన్లోడ్ చేసుకొని చదువుకోగలిగితే మంచిదే. ఎందుకో హార్డ్ కాపీ ఉండాలి అనుకుంటే ఈ మార్గం నేను చూసుకునే మార్గం.
అదే చూస్తా, ఇంకా ట్రై చేస్తా. అది మనకు అప్ టు మనకు ఫిజికల్ గా ప్రాక్టికల్ క్లాసెస్ దానికన్నా ముందు ఇస్తారు, అసైన్మెంట్ ఇస్తే తీసుకొని రాసుకోవాలి.
అది అది ఏమవుతుందో మనం చూడాలి మరి. ఇక వాళ్ళు ఇచ్చిన బుక్ మెటీరియల్ ఇదే కాబట్టి వాళ్ళు ఇచ్చినా ఇవ్వకపోయినా ఇప్పుడు పెద్దగా ఒకసారి మేము జిరాక్స్ తెప్పించుకున్నాం కాబట్టి ఏమండి కృష్ణ గారు బుక్ ఓపెన్ చేశారు ఇవాళ కోర్స్ 4. కృష్ణ గారు
మీ అంత ఫాస్ట్ గా లేదు సార్.
నేనేం ఫాస్ట్ లేను సార్.
మీరు అప్పుడే అందులో ఎక్కువ పేజీలు ఉన్నాయి, రిపీట్ అయిపోయిందంటే పెట్టేశారు కదా.
ఏదో చూసే బుక్ సైజ్ చూసి అనుమానం వచ్చింది, పేజీలు ఎక్కువ పెడితే అది కనబడింది.
నేను మెసేజ్ పెట్టాను చూడండి, మీరు ఆల్రెడీ స్టార్ట్ చేయండి.
లే మీరన్నా అది ఏం వర్తించదులేండి. నేనేం బుక్ చదవలేదు. బుక్ సైజ్ ఎక్కువ ఉంది ఏంటి అని పేజెస్ అట్లా తిప్పుతుంటే అది రిపిటేషన్ కనబడింది. సబ్జెక్ట్ వైజ్ చూస్తే మళ్ళీ టాపిక్స్ యూనిట్స్ సేమ్ ఉన్నాయి. సాఫ్ట్వేర్ అంటే సాఫ్ట్ కాపీ చూద్దాంలే అనుకున్నా, మరి దానిలో కూడా ఇట్లనే ఉంది అనుకున్నా, కానీ అది చూడలేదు నేను.
నేను అనుకున్నాను అమ్మ సార్ అప్పుడే స్టార్ట్ చేస్తారు.
లేదు చదవలేదండి, ఓన్లీ పేజీలు తిరిగేసిన అంతే.
చాలు
చూద్దాం ఏముంది, చదువు మొదలు పెడితే ఆగుతుంది. ఒకసారి మొదలు పెడితే ఆగనే ప్రాబ్లం.
అలా కాదులేండి, చూడాలి.
చూద్దాం.
గుడ్ ఈవినింగ్ సార్.
గుడ్ ఈవినింగ్ అండి. గుడ్ ఈవినింగ్.
గుడ్ ఈవినింగ్ సార్.
గుడ్ ఈవినింగ్ ఆల్ వన్స్ అగైన్. ఎంతమంది ఇప్పటి వరకు ఉన్నది? 12 పెరిగింది సంఖ్య. మన బ్యాచ్ లో డాక్టర్ విద్యాసాగర్ అని ఉన్నారు కదా, తనండి అలోపతి డాక్టరా ఏంటండి? హలో, time is ready to start. ఒకటి కృష్ణ 2 1 2 5 ఉన్నారండి. 13లో 5 మేల్, 8 ఫీమేల్. విద్యాసాగర్ గారు కో-హోస్ట్ అంటే వాళ్ళ. సార్ గుడ్ ఈవినింగ్ సార్.
గుడ్ ఈవినింగ్ అండి. సో ఎవరు హూ ఇస్ కోఆర్డినేటింగ్ ది సెషన్? ఎవరు కోఆర్డినేట్ చేస్తున్నారు? ఎవరు లేరా? ఓకే, దట్స్ ఓకే, నో ప్రాబ్లం. సో ఎవరన్నా కొంతమంది వీడియోస్ ఓపెన్ చేస్తే బాగుంటుందేమో, మరి ఉత్త స్క్రీన్ కి మాట్లాడినట్టు కాకుండా.
చేద్దాం సార్. సార్ మై నేమ్ ఇస్ తిరుపతి.
ఓకే, నమస్తే అండి. నమస్తే
సార్. ఐఎమ్ రిటైర్డ్ డిప్యూటీ జనరల్ మేనేజర్ ఫ్రమ్ సింగరేణి కాలనీస్.
ఓకే, గుడ్ టు సీ యూ.
ఐఎమ్ 74 years old సార్.
ఓకే, వండర్ఫుల్. ఈ ఏజ్ లో కూడా మీరు ఇంకా లెర్నింగ్ ఎంతూజియాజం ఉంది, నేర్చుకోవాలి.
మొన్ననే అంటే లాస్ట్ 2 years బ్యాకే ఎంఎస్సి సైకాలజీ యూనివర్సిటీ నుంచి చేశాను సార్.
ఓకే.
ఈ బ్యాచ్ లో మై సెల్ఫ్, కృష్ణ గారు, మిత్ర గారు, and one more Mallikarjun Reddy is there. We 4 are from our university.
Okay.
This is about me, sir.
Okay, so start chedama. Shall we start?
Yes sir, let us start sir.
Okay, so my paper is counseling skills and techniques.
Sir.
Okay, I hope I probably వాళ్ళు ఇంట్రడ్యూస్ చేస్తుంటారు అనుకుంటున్నాను.
లేదు సార్, ఇంట్రొడక్షన్ కాలేదు సార్.
ఓకే, సో నేను నా నేమ్ మీకు కనిపిస్తా ఉంది కదా, డాక్టర్
అవును సార్.
విద్యాసాగర్. సో
అవును సార్.
నేను నా పిహెచ్డి నేను నిమ్హాన్స్ నుంచి కంప్లీట్ చేశాను.
సార్.
తర్వాత నా పోస్ట్ డాక్టరల్ ఫెలోషిప్ యుఎస్ఏ ఫ్లోరిడా నుంచి కంప్లీట్ చేశాను.
సార్.
దాని తర్వాత ఆల్మోస్ట్ ఒక 15 years క్లినికల్ సైకాలజీ ఫీల్డ్ లో కౌన్సిలింగ్ అండ్ థెరపీ చేస్తా ఉన్నాను. అండ్ కొన్ని అంబేద్కర్ యూనివర్సిటీ బుక్స్ కూడా రాశాను అండ్ ట్రాన్స్లేట్ చేశాను. అండ్ ఐ వర్క్ ఇన్ ఉస్మానియా యూనివర్సిటీ యాజ్ టీచర్, యాజ్ లెక్చరర్, అండ్ నిజాం కాలేజ్ యాజ్ లెక్చరర్. సో రైట్ నౌ ఐ am in private practice.
Sir.
Okay. Sorry. So the first class is on the first unit is on models of counseling, and in that first unit we are going to look at 4 conditions of counseling. Okay.
Sir.
సో ఇది ఒక లెక్చర్ లాగా కాకుండా ఒక ఇంటరాక్టివ్ సెషన్ లాగా ఉంటే మీకు కూడా బోర్ కొట్టకుండా ఉంటుంది. సో మీకు ఎవరైనా విల్లింగ్ గా ఉంటే యూ కెన్ ఇంటరాక్ట్ విత్ మీ.
ఓకే సార్.
సో వాట్ ఈస్ బేసికలీ కౌన్సిలింగ్? సో మీ ప్రకారంగా వాట్ ఈస్ కౌన్సిలింగ్? కౌన్సిలింగ్ అంటే ఏంటి?
అంటే కృష్ణ గారు
డెఫినేషన్ ఉందనుకోండి, కానీ ఆ డెఫినేషన్ చెప్పాల్సిన అవసరం లేదు, వేరే మీ సొంతగా చెప్పొచ్చు.
Counseling is a process by a learned man to his client to understand his difficulties and his abnormalities and help him to come out of that particular situations, difficult situations, and run a free life, free and happy life, normal life.
వండర్ఫుల్. చాలా మంచిగా చెప్పారు. సో ఇంకా ప్రాబబ్లీ ఇఫ్ ఐ వర్ టు యాడ్ లిటిల్ బిట్ మోర్, ఏం చెప్తానంటే బై డెవలపింగ్ సర్టెన్ స్కిల్స్. ఓకే, సో ఎట్లా వాళ్ళు బయటకు వచ్చేలాగా చేస్తాం? బై డెవలపింగ్ సర్టెన్ స్కిల్స్. అండ్ యూ సెడ్ లైక్ లర్న్ మ్యాన్, సో ప్రాబబ్లీ ఐ వుడ్ యూస్ ద వర్డ్ professional use understanding of psychological theories and principles to help the individual understand, develop skills, and come out of the problems. Okay, and one of the most accepted definition of counseling is given by American Psychological Association. It goes like this: counseling is the application of mental health, psychological, and human development principles through cognitive, affective, behavioral, and systemic interventions and strategies which address wellness, personal growth, career development, as well as pathology. Okay, so we use principles of mental health, principles of psychological and human development through variety of mediums. Cognitive is thinking, behavioral, affective is emotions, and behavioral is actions. Systemic is system is basically means it could be a family or it could be couple. Okay, so we also do systemic interventions to address wellness, to function well and develop personal address or help them grow personally, and also develop career, and probably address any abnormalities, which is pathology. Okay, so now, like, how is counseling different from, let's say, the advice that we usually get from our friends, our family members, well wishers? Okay, how does counseling differ? If it is not different from that, there is no use. So if you are giving the same, like if I'm talking like a parent, if I'm talking like a friend, okay, then probably it's not worth it. Okay, చెప్పండి కృష్ణ గారు.
Advice. Sorry.
Okay. No, madam. Carry on. No problem.
చెప్పండి పర్లేదు. ఒకటి చెప్పండి.
Sir, this is Shobha. Advice is like we ask them to do something. But counseling, we empower them and we introduce their strengths to them so that they can solve the problems by themselves.
Okay, so we make them counselors to themselves. Basically, we develop skills so that they can be dependent on themselves. They can be independent, right? You're right. Okay. So that is one. But there is also place for some form of advising. If like depending upon the maturity level, like in terms of psychological maturity, some clients are not capable of deciding for themselves. But initial stage of the development, you may have to probably use some form of suggestions, but it is not the primary medium. Okay. So like you have to look at the maturity level, the ability of the client. Based on that client, you have to change the way you counsel the client. But primarily, fundamentally, what you said is right. We help the client to develop self-awareness or probably understand their own strengths and use their strengths to deal with their own problems. Okay. So now counseling is primarily a relationship between counselor and client. So have you heard a person by name Carl Rogers?
Yes, sir.
So Carl Rogers, a person-centered theory. He developed something called person-centered or client-centered theory. Okay. So in his theory, he talks about one particular thing, that most of the psychological problems or human problems are developed in the context of a relationship. ఈ సైకలాజికల్ ప్రాబ్లమ్స్ అనేవి ఎక్కడ డెవలప్ అవుతాయి? ఒక రిలేషన్షిప్ లోనే డెవలప్ అవుతాయి. Maybe parents are neglectful towards their children, abusive towards their children. Okay. So, or somebody deceived a child, or probably they could not provide for their emotional needs. Emotional needs వాళ్ళు సాటిస్ఫై చేయలేకపోయారు, లేకపోతే అబ్యూస్ చేశారు, వాట్ ఎవర్ ఇట్ ఇస్. ఆ కాంటెక్స్ట్ లో చిల్డ్రన్ ఏమవుతుందంటే దే డెవలప్ ఇష్యూస్. సో సైకలాజికల్ ప్రాబ్లమ్స్ అనేవి ఒక హ్యూమన్ రిలేషన్షిప్ కాంటెక్స్ట్ లో డెవలప్ అవుతాయి కాబట్టి వాటి హీలింగ్ కూడా ఎక్కడ జరుగుతుంది? ఒక హ్యూమన్ రిలేషన్షిప్ కాంటెక్స్ట్ లో జరగాలి. ఎక్కడైతే వాళ్ళకి సరైన ఆ ఫ్యాక్టర్స్ దొరకలేదో అవే ఫ్యాక్టర్స్ ఒక థెరప్యూటిక్ రిలేషన్షిప్ లో ప్రొవైడ్ చేయడం వలన వాళ్ళు హీలింగ్ అనేది పొందుకోగలుగుతారు. ఓకే, ఈజ్ ఇట్ క్లియర్? Human problems or psychological problems are basically developed in a relational context. So they also can get healed in a relational context. కాబట్టి ఆ రిలేషనల్ కాంటెక్స్ట్ ప్రొవైడ్ చేయాల్సింది ఎవరు? As a therapist or counselors, we need to provide that relational context so that they can again get back to their full realization of their own self. Okay, so అంటే కౌన్సిలింగ్ రిలేషన్షిప్ అనేది చాలా ఇంపార్టెంట్. Okay, so counseling relationship is very, very important and it is foundational. Okay, there is a lot of research evidence, and there is the person who contributed a lot to the importance of counseling relationship is Carl Rogers. Okay, he talks about features or core conditions called warmth, వాటన్నిటిని మళ్ళీ చూద్దాం, warmth, genuineness and empathy when you are interacting with client. Okay, so basically in that relationship you create an ideal environment for clients growth. Okay, where you genuinely understand their experiences, you express unconditional acceptance or unconditional positive regard to the client. Okay, and there is a lot of research evidence which supports the critical role of this kind of relationship in counseling and therapy. So basically success, or if you want the client to improve, the success depends upon the quality of the relationship that you will maintain with the client. Okay, so if this quality of relationship is good, so which enables confidence in the client, clients become more open, they become more honest, and they are willing to work on themselves. So that is why this particular relationship is very, very important. And ఈ రిలేషన్షిప్ ఎక్కడ స్టార్ట్ అవుతుంది? ఇట్ స్టార్ట్స్ ఇన్ ద ఇనిషియల్ మీటింగ్. ఓకే, because in the initial impressions itself, or from the moment you meet them, the relationship begins. So because both parties, they reveal who they are, like from the beginning. So if not fully, but to a part that you reveal to people. Okay. So that is why a solid relationship is very, very important for the clients to explore and overcome their difficulties. Okay. And there are probably various barriers, like, for example, uh, uh, like there are issues like boundary issues. Now, like this therapeutic relationship is a specific one. So it is not a friendly relationship. Okay. It's a professional relationship. So now you cannot probably, according to some guidelines, you cannot maintain contact with the client outside the therapy sessions. Okay. You cannot you cannot keep on attending their functions, inviting them to your functions, or asking them for some favors or making some sexual advances. Ivanni kuda, they are all under boundary issues which can probably impair that relationship. Tarvata, there are barriers like long language barriers. If somebody is not able to communicate fully, probably you will not get the message clearly. Okay. So there are factors like certain barriers that might play a role in therapeutic relationship. So you need to take into consideration what are the barriers of therapeutic relationship. Okay. So we are talking about research evidence. Okay. I'm going to show you one research finding which is based on longitudinal study. Okay. Which tells about what works in therapy. Therapy lo aim work avutadi, counseling lo aim work avutadi. Okay. So the next diagram is about what works in therapy. Can you all see this?
Yes, sir. Yes, sir.
Okay. So, ఒక client improve కావడానికి what is the contribution of different factors for clients improvement in a counseling? ఇది ఒక లాంగిట్యూడినల్ ఒక 40-50 years స్టడీ చేసిన రీసెర్చ్ అన్నమాట. ఓకే. సో దీంట్లో yes, good evening Narasimha.
Yeah, sorry to interrupt you.
No.
Just I can interact with the students. Only 1 minute, please.
Okay.
Yeah, good evening, dear friends.
Good evening, sir.
Good evening, sir.
Good evening, sir. How are you all?
Fine, sir.
Fine,
Fine,
sir.
So have you enjoyed this last three courses?
Yes.
Yeah, about this fourth course, Dr. K. Vidyasagar is very well-known clinical psychologist. So please cooperate with him in these sessions. This is very, very important subject compared to other remaining 3 courses because it's a practical application oriented courses. That's why we chosen these kind of persons. This is the expert total field of psychology. Yes. మీకు గత 3 కోర్సెస్ నాకు తెలిసి అందరికీ అర్థమైంది అనుకుంటున్నాను. ఎస్
సార్.
అంటే కొంతమేరకన్నా మీరు ఆ లర్నింగ్ లో మీరు ఇన్వాల్వ్ అవుతున్నారని అర్థమవుతుంది. బట్ ఈ 3 కోర్సులను మనం పోలిక చూసుకుంటే కనుక ఈ 4వ కోర్సు చాలా చాలా ముఖ్యమైన కోర్సు. ఎందుకంటే కౌన్సిలింగ్ ఫీల్డ్ లో కౌన్సిలింగ్ స్కిల్స్ అండ్ టెక్నిక్స్ అనేది మనకు అవుట్ సైడ్ ఫీల్డ్ లో సొసైటీలో మనకు అప్లికేషన్ ఓరియంటేషన్ లో చెప్పాలంటే ఇంత మంచి ఎక్స్పర్ట్ మీకు ఒప్పుకోవడమే ఒక రకంగా మనకు అదృష్టంగా భావించాలి. యాక్చువల్ గా సాగర్ విద్యాసాగర్ చాలా బిజీ ఉంటారు క్లినికల్ సైకాలజిస్ట్ గా వేరియస్ అకాడమిక్ యాక్టివిటీస్ అండ్ క్లినికల్ యాక్టివిటీస్లలో. బట్ ఆయన యొక్క ఈ అకాడమిక్ ఇంట్రెస్ట్ ను బట్టి BRAOUకు ఒప్పుకోవడము ఒక రకంగా డిపార్ట్మెంట్ నుంచి మేము కృతజ్ఞతలు చెప్తున్నాము. వీఆర్ వెరీ థ్యాంక్ఫుల్ విద్యాసాగర్ అండ్ వీఆర్ వెరీ interestingly waiting for your valuable inputs to the BROE students.
Thank you.
So
Definitely.
So thank you very much and sorry to disturb you. So
No
మీకు ఏదైనా జనరల్ డౌట్స్ ఉంటే కనుక స్టూడెంట్స్ ప్లీజ్ జనరల్ డౌట్స్ ఏదున్నా కూడా మీరు మోస్ట్లీ విద్యాసాగర్ చెప్పే దాంట్లో అకాడమిక్ దెన్ క్లినికల్ ఓరియంటేషన్ డౌట్స్ అడగండి. జనరల్ డౌట్స్ ఉంటే కనుక తప్పకుండా మీరు మన వాట్సాప్ గ్రూప్ లో మీరు జనరల్ డౌట్స్ అడగొచ్చు. రిమైనింగ్ ఈ 4 కోర్సెస్ అయిపోయిన తర్వాత మీ అసైన్మెంట్స్ పాటు రిమైనింగ్ అని మేము ప్లాన్ చేస్తున్నాము. మళ్ళీ మీకు త్వరలో మీకు టచ్లోకి వస్తాం. ఓకే, సో ఈ 14 days ఇది చాలా ముఖ్యమైన కోర్సు కాబట్టి 4th కోర్సు, ప్లీజ్ కాన్సన్ట్రేట్. ఓకే,
ఓకే సార్. ఓకే సార్.
థ్యాంక్ యూ వెరీ మచ్ సాగర్. Please proceed your. Yes sir.
Yeah, thank you. So this research, this particular finding is based on a longitudinal research. Longitudinal research means they have followed clients for a long period of time. Okay, and so based on that research, they have come up with this finding. If you see this diagram, what you understand is, like, in a client's outcome, in a client's improvement, 40% role is played by what?
Extra therapeutic events.
Client variables and extra therapeutic events.
Clients variables and extra therapeutic events, they play 40% role in change in the client. Okay, so ANTV, what are these extra therapeutic events or client variables? Okay, for example, like while the client is in the therapy, client is in the counseling, client ko oka promotion వచ్చింది. ఓకే, ఆయనకున్న ప్రాబ్లము వేరే వాళ్ళ ఇంటర్వెన్షన్ వల్ల సాల్వ్ అయిపోయింది. ఓకే, సో are you doing anything here as a counselor? Are you doing anything here?
No,
you are not doing anything. So if 40% of the factors are not part of your counseling, you don't have any control over extra therapeutic events. They are outside therapy, things that happen outside therapy. So outside therapy factors ఎంత వరకు కాంట్రిబ్యూట్ చేస్తాయంట?
40%.
40%. సో అంటే 40% నీ కంట్రోల్లో ఉండదు ఫస్ట్. ఓకే, మిగతా 60% లో మాక్సిమం రోల్ ప్లే చేసేది ఏంటి?
Therapeutic relationship.
Yes, that is what I want you to understand. The therapeutic relationship plays a maximum role in the rest of the 60% of the change in the clients. Okay, so I want you to understand the importance of their therapeutic relationship. You may not know any techniques, any factors. Okay, నీకు టెక్నిక్స్ ఏం తెలియకపోవచ్చు, ఫ్యాక్టర్స్ తెలియకపోవచ్చు, కానీ ఇఫ్ యూ క్యాన్ మెయింటైన్ దీస్ థెరప్యూటిక్ రిలేషన్షిప్ ఫ్యాక్టర్స్, you can bring 30% of change in the client. Are you able to understand the crucial role of therapeutic relationship?
Yes sir.
Yes sir.
Okay, see, and again there is a 15% of change that is contributed by something called expectancy and placebo effect. So what is expectancy and placebo effect?
Expectancy means what we
Expect
or anticipate.
Okay, for example,
placebo means there is no drug, but it will give a mental satisfaction that it will cure.
Yeah, so అంటే ఈ 15% కూడా ఒక కౌన్సిలర్ చేతిలో ఉండదు. ఇట్స్ నాట్ ఇన్ ద హ్యాండ్స్ ఆఫ్ ఎ కౌన్సిలర్. ఓకే, ఎక్స్పెక్టెన్సీ అంటే యాజ్ ఎ క్లయింట్, ఇఫ్ ఐ బిలీవ్ ద థెరపీ ఈస్ గోయింగ్ టు హెల్ప్ మీ, ఓకే, ఆ బిలీఫే ఇట్ మేక్స్ ద థెరపీ సక్సెస్ఫుల్. ఓకే, అంటే 15% of the change is because of the client's belief in whether the therapy will work or not. ఓకే, అంటే మిగతా ఉన్న 45% లో ఒక 15% మాత్రమే టెక్నిక్స్, మోడల్ ఫ్యాక్టర్స్, బట్ రెస్ట్ ఆఫ్ ద 30% ఈస్ బికాస్ ఆఫ్ ద థెరప్యూటిక్ రిలేషన్షిప్. సో ఇఫ్ యూ క్యాన్ ఫోకస్ ఆన్ developing the skills of that therapeutic relationship, you can bring change, 30% of the change in clients' problems. So that is the importance of therapeutic relationship in a counseling process. Is it clear? Okay, so in the next slide we are going to see what does this therapeutic relationship involve. According to Rogers, what does it involve? What does it comprised of? So according to Carl Rogers, the counseling relationship is comprised of warmth, responsiveness, and unconditional positive regard. Okay, that is where you express genuine interest in the client and you accept him as a person. Okay, the second thing is freedom from judgment, pressure, and force. Okay, that is you're skillfully keep yourself away from like imposing your own values, imposing your own biases in whatever the client is saying. Okay, so you probably refrain from advising, suggestion. You don't pressure the client to follow a course of action. Okay, so you don't judge the client, you give some freedom. There is also permissiveness regarding emotional expression. Like once you develop this relationship, once you establish this relationship, what you are doing is you are making the client to feel free to express any emotion, any thought without any inhibition. Because the client is feeling accepted, he is going to express it fully. If he is able to express fully, you can understand, it will help you understand the clients and also help the client understand himself in a better way. Okay. The next thing, according to Rogers, counseling relationships should also have boundaries. Okay. We have just spoken about boundaries. That is, like the counselor must maintain boundaries, such as, like, for example, starting the session on time. Okay. Ending the session on time. Using evidence-based methods, not your own methods. Okay. So, like, suppose if you are going to a counselor, or if you are going to a doctor, you don't want them to use anything that they want to use. You want them to use the best possible medicine, right? You don't want them to try this, try that, try this. So that's why you need to be very ethical in terms of what strategies that you are going to use. The most evidence-based strategies that you need to use. Is it clear?
Okay,
The
sir.
next thing, yeah. So there is a process of counseling. There are certain steps that we follow in counseling. So just look, have a look at general process of counseling. Okay. So we can probably, like, there are many different steps, but generally we can divide counseling into different processes, 6 components. Okay. First thing is opening, which is the initial process of counseling process and the most important, because it is where like with the counselor and client get the opportunity to know each other. Okay. And this is where counselor can set the tone for the therapeutic relationship. The second thing is exploration. This is where you try to explore, understand clients at this particular stage. Okay. You try to explore what? Their past and their current situation. Okay. And you work along with the client in this particular stage to establish what are their goals, what are their expectations from the therapeutic relationship. After you explore, next thing comes understanding. In this stage, like, you still continue to develop your relationship, and you also show to the client that you are clearly understanding their needs and their desires, and you are more attentive to, like, how the client is presenting both verbal and non-verbal cues of the client in order to understand fully what the client is trying to convey. So once you also, it also helps you to understand what are their problems and why these problems are continuing, how they have developed and why they are continuing now. Once you understand how they have developed, why they are continuing, now you start intervention. Okay, intervention means, like, you are using specific techniques or set of techniques that you think are most effective in promoting growth in the client. Okay. And probably these techniques that you choose, probably they can vary greatly between clients depending upon the kind of background of the client and personal characteristics of the clients. Some techniques that are useful for one client may not be useful for other clients. So you have to decide what techniques that you are going to use. Okay. Then there is something called deep probing. Now, exploration is at one level, deep probing is at another level. So you have to move, just not just understanding, you have to move towards personal growth and solving the client's issues. That's where this deep probing is required. So what do you do in deep probing? you help, you understand clients' thoughts, feelings regarding their important issues, how they are thinking about their issues. Okay, what are their feelings regarding their pressing concerns? Okay, and you help them identify, uh, are there any blind spots there that they are not able to see? What are their ways of thinking? So you help them identify in this deep probing. Then you go to working out options. Like once you have a clear understanding of their thought processes, their lack of skills, and now you identified clearly what are the issues and what can be done in order to deal with those issues, you work out different options. Okay, so that's where you means you don't work out options to meet your goal, but the meet the goal of the client. Okay, so you provide variety of probably solutions for the client's problems, and you encourage them to follow through whatever the suggestions that you have given them. Okay, so that is the general process of counseling. It starts with opening, where you start developing initial relationship. Exploration is where you try to explore their problem and you try to understand their problem. Once you understand, you start intervening using certain techniques, and you further the growth of the client by deep probing, and then you come out with certain solutions to implement. Okay, so now we are coming to the important aspect of today's class is four conditions of counseling. There are four conditions of counseling according to Carl Rogers. These four conditions are the conditions they must be met in order for the success of your counseling or success of your therapy. Okay. What are these four conditions? Okay. So I've just given one quote by Carl Rogers here. Let me just read it. It is that the individual has within himself or herself vast resources for self understanding, for altering his or her self concept, attitudes, and self directed behavior, and that these resources can be tapped if only a definable climate of facilitative psychological attitudes can be provided. So basically, what this quote is saying is, client has the ability to change himself. Client has the resources to improve themselves. But in order for the client to use those resources, you need to provide a certain environment where you can facilitate those usage of those skills or usage of those abilities. So who provides that psychological climate? It is the counseling relationship that provides that psychological climate. That's when client can move towards self actualization. Okay, what is self actualization? So basically, it is self actualization actually means a positive view of human psychology, where we accept that every person has innate desire to grow and engage in a meaningful self exploration of feelings, beliefs, and behavior, and to facilitate that growth process in the client. Okay, and you also empower them to face current and future challenges. Okay, so that is what self actualization is. So now, what are these core conditions of counseling? The first core condition of counseling is genuineness. Okay, first core condition of counseling is genuineness. It is also called congruence. Okay, genuineness and congruence. What do you understand by genuineness and congruence? Can anybody say what is being congruent?
Some integrity of his own.
Wonderful. Yeah. Yeah. So there is an integrity. Okay. That you're not probably, let's say, you're not a hypocrite. Okay. You say something, you do something. Now that means that you're not, there's no integrity, right? There is no congruence. So integrity and congruence means you are being real, you are being genuine, you are being authentic. Okay. So let's look at what is this genuineness. Okay. Genuineness means it refers to the therapist's ability or counselor's ability to be authentic and transparent during the therapeutic process. You are authentic and transparent. There are no hidden agendas. There are no hidden motives. There are no manipulation. You are being real. Okay. So it involves being real, honest, and open with the client, allowing them to experience the therapist as they truly are. You're not trying to put up a mask. You're trying to show yourself who you truly are. So when you do that, they will also get encouraged, okay, to be their true self. Okay, if you are not being genuine, they also find it very difficult to be genuine. Okay, so genuineness is very, very important. If the client is not genuine, is definitely not going to get benefited from the therapy, because he's not going to talk about his deeper issues, because he's not feeling confident to be open, be transparent with you. So therapist's genuineness or counselor's genuineness helps the clients to be genuine. Okay, and it is the primary attribute of effective therapist. Okay, and so what you what you experience inside, you express outside. You don't manipulate. That is what being genuine. Whatever you are experiencing inside, you don't manipulate and change and say something else. You are being real. So that is the primary attribute of effective therapist. Okay, what it does is it actually builds trust. Okay, because genuineness means there is no facade. Okay, as a therapist, as a counselor, you present your true self, which builds trust in the therapeutic relationship. Okay, and you are also modeling authenticity for clients. Like let's see what are those benefits. Okay, you are modeling authenticity for the clients. Okay, what you're doing as a counselor, when you are genuine, you're setting an example for clients by expressing your thoughts, feelings honestly, you're also encouraging the clients to do the same. Okay, and there is also consistency you display. When you are genuine, you display consistency in verbal and non-verbal cues. Okay, so that is like what you think and do, there is an alignment in what you think and do. Okay, so if there is a discrepancy between what you think and what you do, then that means you are not congruent, you are not genuine, you are being incongruent. Okay, and this is essential for all forms of counseling. Okay, genuineness helps build a solid foundation of trust between counselor and the client. Okay, then the next thing is openness to awareness and accurate symbolization. So basically it means this genuineness or congruence between what you feel inside, what you express outside, involves like you're open to awareness of what is happening inside, and you're able to express them out clearly. So that itself, most people are not aware of what is happening within. So if you do this, you're actually encouraging the clients to get in touch with their inner experience and be authentic with those inner experience and express them. Okay. The next thing is like when you are genuine, you combine congruence with unconditional positive regard and empathy. So genuineness, you cannot be genuine if you cannot combine it with unconditional positive regard and empathy. Okay, and so therapists who are congruent, they understand their feelings and thoughts, and also show at the same time unconditional positive regard and empathic understanding for the client. That means they don't judge the clients. Okay, as they are open about their own feelings and thoughts, they allow the client to express their own feelings and thoughts without judging them. Okay, and there is also, when you are genuine, there is also transparency and responsibility. Okay, so when you are authentic, when you are real, That means you are open, you are transparent, you are realistic, you are taking responsibility for your life choices. Okay, and you are fully aware of what you are saying and doing. So you are by doing that, you are modeling to the client this transparency and responsibility. Okay, so that's why genuineness plays a major role in counseling process. Okay, did you get this? Genuineness means నువ్వు లోపల ఏమైతే ఫీల్ అవుతావో బయటకు కూడా అదే చెప్తావు. దెర్ ఈస్ నో ఇన్కాంగ్రియన్స్. లోపల ఒకటి అనుకొని లోపల ఒకటి బిలీవ్ చేసి లోపల అనుకొని బయట ఒక రకంగా ఉంటావు. సో యూ షో దట్ నువ్వు ఎట్లా ఉన్నావు అట్లని చూపించడమే జెన్యున్నెస్. వెన్ యూ డూ దట్, అప్పుడు ఆ క్లయింట్కి కూడా నువ్వు ఒక అవకాశాన్ని ఇస్తావు, వాళ్ళు కూడా అథెంటిక్ గా ఉండడానికి, వాళ్ళు కూడా జెన్యున్ గా ఉండడానికి. సో ఇంతకుముందు బయట వాళ్ళంతా జడ్జిమెంట్ ఫీల్ అయి ఉండొచ్చు, ఓపెన్ కావడానికి అవకాశం రాకపోయి ఉండొచ్చు. ఎప్పుడైతే యాజ్ ఎ కౌన్సిలర్ గా నువ్వు ఓపెన్ గా జెన్యున్ గా ఉంటావో అదే సమయంలో వాళ్ళకు కూడా అవకాశం దొరుకుతుంది జెన్యున్ గా ఓపెన్ గా ఉండడానికి. అదొక సెల్ఫ్ గ్రోత్ ఆస్పెక్ట్ అన్నమాట. Okay, did you understand this? Yeah. So the next core condition is empathy. Okay, next core condition is empathy. So మనం చాలా సార్లు యూజ్ చేస్తుంటాం empathy అనేది. Okay, so empathy means it is the ability to put yourself in someone else's place or someone else's shoes, understanding their experiences, feelings and worldviews without imposing your own values, your own biases, your own judgments. Okay, ఇది లేకపోతే థెరపీ సక్సెస్ కాదు. Okay, if somebody comes and says that I am a gay, okay, if your values say that no, this is not right, then you won't be able to accept. See, you can have different values, but still you should be able to show empathy, where you respect the other person and respect other person's feelings, opinions and experiences. You don't like force your own values on the other person and say you are wrong, what you are doing wrong, what you are saying is wrong. That is not empathy. Okay, if there is no empathy, then you are not a counselor at all. Okay, so empathy is very, very, very important. Again, one important factor is empathy is not sympathy. Okay, so what is sympathy? Sympathy ante, if somebody's mother died, I'm truly sorry for your loss. Simply saying that I'm sorry for loss is sympathy, some form of sympathy. Whereas empathy, you go deep and really understand what the client is going through, what that person is going through. How is it for the client to lose his or her loved one? You really understand and communicate. Not only understanding, you communicate that to the client. Okay, it must be very painful. It is a big loss for you, right? So like how they are feeling, you try to understand. So empathy is a central aspect. Now, as I said, you need to distinguish empathy from sympathy. Okay, so sympathy involves just feeling sorry for someone else's problems. Empathy is something that it is going beyond that, like where you are trying to genuinely understand what the other person is going through. So in order to be truly empathetic, you need to actively listen, you need to be open without any biases, you need to be willing to connect with the client's emotional world. Okay, then only you can be truly empathetic. And as you can see, empathy is foundational to effective counseling. Okay, because empathy is essential for building trust and good rapport with clients. So if you are empathetic, the clients feel safe, the clients feel understood, clients feel validated. When they feel understood, when they feel validated, I would say that a significant portion of their problems are solved, because probably before they come to therapy or counseling, they would have experienced, they would have shared it with many people without being understood, without being validated. when you are truly empathetic, you are providing a different experience for the client, which they have not experienced anywhere else. Right? If you are like anybody else, probably you would also judge the clients, you would also invalidate the client. Okay. So without empathy, like your counseling is not deep. You cannot, probably you will fail to address the client's core concerns, core problems. Okay. And in empathy, you avoid imposing your personal values. Okay. Which means it doesn't mean that you have to take their values, their beliefs and behaviors as your own. You don't need to take them. But it's about understanding that they can have their own perspective. Their perspective is unique. That's what you understand. So as a counselor, you must be objective and don't project your own biases onto the client. Okay, that is very, very important. Okay. But sometimes there can be some challenges in developing empathy, right? Like some areas are, like, for example, some clients may be harder to empathize because they might have different spiritual beliefs than yours. Okay, they might have a different sexual orientation than yours, or they might have different gender identity than yours. But still, you should be able to understand them and value them and accept them as they are. If you find it difficult, like sometimes some clients or some counselors might find it difficult. It is very, very important that we seek supervision immediately, and we also learn to process our own feelings. Okay. And according to Carl Rogers, okay, empathy is the cornerstone of client-centered therapy. It is the chief cornerstone of client-centered therapy. So, he gave a nice definition. He described empathy as to sense the client's private world as if it is your own, as if it were your own. Okay. ఇక్కడ చాలా ఇంపార్టెంట్ పదం ఏంటిదంటే యాజ్ ఇఫ్. ఓకే, యూ డోంట్ లూజ్ యాజ్ ఇఫ్ క్వాలిటీ. యూ డోంట్ ఓవర్ ఐడెంటిఫై విత్ దేర్ ఫీలింగ్స్. ఓకే, క్లయింట్ యొక్క ఇన్నర్ వరల్డ్ ని, ప్రైవేట్ వరల్డ్ ని, ఒకవేళ నీ వరల్డ్ అయితే ఎట్లా ఉంటది అన్నట్టు, ఒకవేళ అన్నట్లే కానీ నీ వరల్డే చేసుకోకూడదు దాన్ని. ఓకే, యాజ్ ఇఫ్ క్వాలిటీ is very, very important. So by you understand their life from, like, you understand the life from client's viewpoint. Okay, by understanding, then probably you get a good understanding of the client's problems, and probably you can invite them for positive change. Okay, there are benefits of applying empathy in therapy. Okay, so you can deeply understand the feelings of the uh, uh, client, and you can clearly communicate, and you experience different levels of emotional connection. Okay, there are 3 levels of empathy where you understand emotions, where you understand their thinking process. Okay, where you understand their feelings and communicate those feelings. So empathy is as Carl Rogers puts it, empathy is the cornerstone, and it creates an environment for healing and transformation. So I want you to always remember the diagram, that pie diagram that I have shown you, that all these 4 conditions, bring 30% of change in the client. They have the ability to bring 30% of the change in the client. Just being genuine and being empathetic and showing unconditional positive regard can bring 30% of the change in client. Okay, so if these things are not there, what we are doing is probably not counseling. ఇవి లేకపోతే మనం చేసేది కౌన్సిలింగ్ కిందకి లెక్క రాదు. ఓకే, so the next core condition of counseling is unconditional positive regard. Okay, unconditional positive regard. So what is unconditional positive regard? It is accepting, like, it is a kind of attitude of acceptance and loving love towards the client at a deep level, regardless of their surface behaviors and actions. మనం వాళ్ళు చూపించే బయట చూపించే బిహేవియర్స్ యాక్షన్స్ కి వెనక వెళ్ళి దాని వెనక ఉన్న పర్సన్ ని పూర్తిగా మనము యాక్సెప్ట్ చేయగలగడం. ఓకే, అయితే ఇక్కడ ఒక ఇంపార్టెంట్ పాయింట్ ఏంటిది అంటే, యూ డోంట్ యాక్సెప్ట్ ఎవ్రీ యాక్షన్ టేకెన్ బై ద పర్సన్. ఓకే, you are not agreeing with every action taken by the person, but you are going beyond and accepting that as a person he is worthy of respect, as a person he is worthy of regard, okay, or love, he is worthy of love. That's how you see the client. Okay, that is what unconditional positive regard is. So unconditional positive regard, how does it help? Okay, for example, one example of unconditional positive regard is uh, uh, between parents and children. Okay, so what usually good parents do is they show unconditional positive regard to their children. That means they love them regardless of their behavior or mistakes. Do you agree?
Yes, yes, sir.
Yeah, that
Yes,
is
sir.
what unconditional positive regard is. That just because they made mistakes, you don't discard them. You don't say that you are unworthy. Okay, so that is, we are letting the child know that they are good person even when they misbehave. Okay, your behavior is wrong, but you are not wrong. We are not accepting the behavior, but we are not rejecting the person. Okay, మన బిహేవియర్ ని యాక్సెప్ట్ చేయట్లేదు, అట్లని పర్సన్ ని కూడా రిజెక్ట్ చేయట్లేదు. వి రిజెక్ట్ ద బిహేవియర్ బట్ యాక్సెప్ట్ ద పర్సన్. బిహేవియర్ ని రిజెక్ట్ చేస్తాము, పర్సన్ ని యాక్సెప్ట్ చేస్తాము. ఓకే, సో అట్లనే ఇప్పుడు ఒక స్పౌసెస్ మధ్యలో ఆర్గ్యుమెంట్ అయినప్పుడు, ఓకే, you probably reassure, you assure your partner that just because there are arguments, it doesn't mean that I will hate you. I continue to love you, I continue to respect you even when we have arguments, even when we have differences. That is what unconditional positive regard is. That's how you need to act towards your client as well. Clients might have different views, clients might have different values. It doesn't mean that you disrespect them. Okay, so it's basically, it also means, an example would be supporting a friend or family member without judging them regardless of their choices. They might have made wrong choices, but you don't judge them. You're still there with them. You may not agree with their choices, but you still tell them that you still love them. Okay, that is what unconditional positive regard is. Okay, and yes, please, adagandi.
Can we say that human rights will come under this unconditional positive regard? Because some people do some crimes or some mistakes by force of their situational in life, but we have to respect them as a human being.
Yes, so I think probably the fundamental position that they are holding is that humanistic in nature,
Yes.
that they value. Yeah,
Yes,
I agree with you. Okay, so there are positive effects of having this unconditional positive regard. Let's see what are those positive effects. Okay, so basically, having unconditional positive regard promotes client's sense of self-worth. That is, when you express warmth and respect for the client, okay, the client starts to feel worthy and it encourages their self-growth. Okay, when you are showing unconditional positive regard, it encourages authenticity in the client. Okay, so it allows clients to be their true selves. Like they are able to reveal their deepest fears and secrets, like because they feel accepted, because they feel that they won't be rejected. Okay, and it also facilitates personal growth. It nurtures clients' growth by conveying that acceptance, grace, even in the face of their, let's say, wrong choices or mistakes or failure. Okay, and it helps build trust and rapport. And it also creates a safe and supportive space. Like if you're showing unconditional positive regard, it provides a non-judgmental and supportive environment where clients can explore their experiences without fear of being criticized, without fear of being rejected. Okay. And when you show unconditional positive regard, it validates clients' feelings and experiences. So since we are validating, they feel validated, it promotes emotional healing and they also feel empowered. Okay. And unconditional positive regard also supports the self-acceptance in the clients. Self-acceptance in the clients. That is, when you are accepted, you see that you are accepted by the other person, you start to respect yourself. You start to accept yourself. Okay. So unconditional positive regard helps clients to develop a positive self-image and self-acceptance. Okay. And it also, as you can clearly see, when you feel accepted fully, you trust the person. So that means it builds a good therapeutic alliance, good therapeutic relationship, right? And it also probably facilitate congruence and authenticity. Okay. When using unconditional positive regard in combination with empathy and genuineness, like as we had already discussed, it helps clients to become more congruent with themselves, more real with themselves. Okay, whatever they are internally experiencing, they will be able to present externally as well. They don't hide anything, they don't fear expressing anything. So thereby they are able to process all those deepest fears. Okay. And it also promotes positive change. Okay. If you provide a safe and validating space, unconditional positive regard encourages clients to engage fully in the process of therapy or in the process of counseling. So, which is very important, which because it leads to meaningful personal growth and positive change. Okay. So that's why these three core conditions are very, very important. Okay. What are these three core conditions? Genuineness or congruence, empathy, and unconditional positive regard. So, like after this class, like one thing that you can take away is like understand the importance of these three core conditions for a therapy to be successful, for counseling to be successful. Because as we have seen research evidence, in the factors that we can control, 30% of is contributed by relationship factors, that is therapeutic relationship factors, which are these core conditions. So just there are certain people who are by nature they are genuine. Okay, there are certain people by nature they can easily show empathy. Okay, and there are certain people by nature they respect other people. Imagine like in your own life, like if you were to discuss certain issues, would you discuss with somebody who keeps judging you, who keeps invalidating you, who doesn't show empathy, who never listens, always gives suggestions? You won't. Okay. Same way, in a counselor, they have to experience counseling relationship in a different way. If it is similar to what they are experiencing outside, then the counseling of no use for them. So, for a counseling relationship to be unique, and to facilitate change in the client, it has to have these three core conditions. That is genuineness or congruence, empathy, and unconditional positive regard. Is it clear? Okay. So if you have any questions, please ask me. Do you have one more class after this?
No, sir. This is only for another 12 days. We have only your class, sir.
Okay. So yeah, if you have any questions, please ask. And if you really want to be, let's say, counselors,